Yeah.
and left intrabuccal mucosa. The fiber optic nasopharyngoscopy reveals a moderately deviated nasal septum to the left, large inferior terminates. You have developed persistent paresthesia of the left manual teeth and tongue, possibly neoplasm within the mandible. You have also developed hypogeusia with loss of taste and dry mouth syndrome called xerostomia. I would suggest you have a CT of your head,
This
including
is part
sinuses and
extract
mandible,
1.
so
Afterwards,
that I can
extract 2 will
evaluate and
start.
make sure you have not
Be ready.
developed
Write
neoplasm.
down the numbers
Take plenty
13
of
to
fluids
24
and
in
come
your
and see me
notebook.
again when you get your diagnosis reports. Extract 2, questions 13 to 24. You hear a physician talking to a patient called Mr. Tulensru. For questions 13 to 24, complete the following notes with a word or short phrase. You now have 30 seconds to look at the notes.
Hello, doctor. Good morning.
Good morning. May I find out what the problem is?
I've been experiencing the symptoms of heart failure for the past year, doctor. Although it appears okay in general, I feel a lot of stress and fatigue. I've also noticed shortness of breath with exertion. I am getting attacks of severe shortness of breath and coughing that usually occurs while I'm sleeping. I have developed edema and had a mild leg swelling a while ago.
Do you have severe chest pain called angina, palpitations, or syncope?
No, doctor, but I feel some irregularity in my pulse. Over the past 10 months, these symptoms have been gradually worsening. Over the past year, I've gained about 20 kilograms in weight, doctor.
What's your age?
63, doctor.
Have you had any previous illnesses?
I had right inguinal hernia surgery 7 years ago. I had trauma to my right thumb.
Do you have diabetes, mellitus, or heart murmur?
No, doctor.
Do you smoke or drink?
I don't smoke, but I drink.
Tell me about your family history. Any illness?
My mother's alive at 92. My father died at 76 of a heart attack.
Are you taking any medications?
Yes, doctor. Aspirin, 81 milligrams daily, and chlordiazepoxide and clidinium combination pill at 5 milligrams or 2.5 milligrams, 1 tablet daily for stress.
Are you allergic to any medicines?
No, doctor.
Okay, well, according to my comprehensive cardiovascular examination, your blood pressure is 120/70 in each arm seated. Your pulse is 80 beats per minute and regular. Your breathing is 2 times per minute, and that is unlabored. Lungs are clear to auscultation and percussion. The first and second heart sounds are normal. You have a fourth heart sound and a soft systolic murmur. The precordial impulse is enlarged. Your electrocardiogram shows sinus rhythm with left ventricle hypertrophy. Your peak oxygen consumption was 19.7 milliliters per kilogram of body mass per minute, which is consistent with mild cardiopulmonary disease. Laboratory data shows your thyroid stimulating hormone 1.33. Your glucose is 97 and creatine 0.9. Potassium is 4.3. I reviewed your echocardiogram thoroughly. That shows a dilated cardiomyopathy with ejection fraction of 15%. Your post-stress ejection fraction is 33%, and left ventricular cavity appears enlarged. This appears to be a newly diagnosed dilated cardiomyopathy of uncertain etiology and dyslipidemia. I'm going to prescribe angiotensin converting enzyme inhibitor lisinopril 2.5 milligrams daily and a beta blocker carvedilol 3.125 milligrams twice daily. In addition, you could benefit from a loop diuretic, furosemide 20 milligram daily. I don't think you need a defibrillator right now, and after 3 months of medication, I want you to go on an echocardiogram. If your left ventricular function has not improved, then you would benefit from a prophylactic use of an implantable cardioverter defibrillator. So continue with these medications and meet me after a period of 3 months.
Thank you, doctor.
So we have completed this test. So let us check the answers. Yeah, you can go through this. So the second part, 13 to 20.
That is the end of part A. Now look at part B.
Yeah. So that's it. From 14th onwards. Here. Correct your papers. Yeah, it's a little bit tough because big words are given. Nah? Yeah, no problem. Try your. Okay, it's a practice test. No worries. I told you already, it's not authentic material. But as far as possible, whatever you had done, that's okay. At least you'll get some idea, right? Because in the official paper, this type of questions will not be there. It's okay, Yashodhara, no problem. Yeah. So after finishing, you can submit your score. Submit your scores, please. Yes, 7, 6, 5, 4, 3, 2, 1, and submit. Submit your scores, please. This is the answer. These are the answers.